Welcome to Part 19 of Top 100 Essential Medicines Every Pharmacy Student Must Know. This video focuses on generic names, brand names, doses, and simplified uses of crucial medications. Pharmacists need to be familiar with common drugs, their uses, and dosages. This video series covers the 50 most essential medicines frequently dispensed in hospitals and retail pharmacies. Starting with analgesics and antipyretics, we cover paracetamol, known for fever and pain relief, ibuprofen and NSAID for pain and arthritis, and diclofenac, an NSAID used for inflammation. Next, we have more analgesics and antibiotics. Aceclofenac is used for musculoskeletal pain. Amoxicillin, a penicillin, treats throat infections, while azithromycin, a macrolide, is for respiratory infections. Continuing with antibiotics, sulfiximate is a cephalosporin for UTIs and ENT infections. Ciprofloxacin, a fluoroquinolone, targets GI and urinary infections. Metronidazole, a nitroimidazole, treats anaerobic infections. In antacids and anti-ulcer medications, pantoprazole and omeprazole are PPIs for acidity and GERD, respectively. Ranitidine, an H2 blocker, is used to treat ulcers. For anti-ulcer and allergy, sucralfate protects against ulcers. Cetirizine and loratadine are antihistamines, used for general allergies, cold symptoms, and allergic rhinitis. Moving to antihistamines and blood pressure, chlorpheniramine is a first-generation antihistamine for sneezing. Levocetirizine treats urticaria. Amlodipine, a CCB, is prescribed for hypertension. In antihypertensives, losartan and telmisartan are ARBs for blood pressure control and hypertension. Metoprolol, a beta blocker, is used to control heart rate. For anti-diabetics, metformin is a biguanide for type 2 diabetes. Glimepiride, a sulfonylurea, also treats type 2 diabetes. Insulin is a hormone for type 1 diabetes. This segment covers anti-diabetic and cardiac medications. Dapagliflozin is an SGLT2 inhibitor for type 2 diabetes. Atorvastatin, a statin, treats high cholesterol. Clopidogrel, an antiplatelet, is a blood thinner. For cardiac and respiratory health, aspirin is an antiplatelet for heart protection. Nitroglycerin, a nitrate, relieves chest pain. Salbutamol, a SABA inhaler, is used for asthma. In respiratory and cough medications, budesonide is a corticosteroid for maintenance therapy. Montelukast, a leukotriene antagonist, treats allergic asthma. Ascaril is an expectorant combo for cough relief. For cough, cold, and vitamins, dextromethorphan is an antitussive for dry cough. Dolocold is a decongestant combo for cold and fever. Multivitamin supplements support general health. This section covers vitamins and supplements. Folic acid is for anemia and pregnancy. Calcium plus vitamin D3 enhances bone strength. Iron plus folic acid is another supplement for anemia. Moving to pain and muscle relaxants, tizanidine and methocarbamol are muscle relaxants for muscle spasms and back pain, respectively. Tramadol, an opioid analgesic, is used for severe pain. For antidepressants and anti-anxiety medications, escitalopram and sertraline are SSRIs for depression and OCD. Alprazolam, a benzodiazepine, helps with anxiety and sleep. Common OTC medicines include ORS packets for dehydration, loperamide as an antidiarrheal, and antacid gel for acidity relief. In OTC and emergency drugs, povidone iodine is a topical antiseptic. Adrenaline is a sympathomimetic for anaphylaxis, and atropine, an anticholinergic, treats bradycardia. Continuing with emergency drugs, furosemide, a diuretic, is used for pulmonary edema. Hydrocortisone, a corticosteroid, treats allergic shock. For storage and organization, arrange medicines by therapeutic category and alphabetically. Keep refrigerated drugs separate, track expiry dates, and store look-alike, sound-alike drugs separately to prevent errors. In conclusion, these 53 drugs are fundamental for every pharmacy student and intern. Knowing their dose, use, and proper storage is essential for effective practice.